Hello everybody, welcome to MedSurg 4. I'm trying something new. I will be reviewing your syllabus via called Swivl, and I will have this available so you can view it. Please view it before you come to class so that we have more time to address content. I will address some of the syllabus on our first day of class, but if you could listen to this video and please come with questions that you have about the syllabus. So I'll talk about your assignments, requirements, and also clinical. So first, please read the course description in your syllabus and the course objectives. And then requirements for this course is your Lewis textbook, which you've used for your other MedSurg courses. You will also use Nursing Central and VSIM. We will use that as well. Also, you need reference point for writing your papers, as your papers, as always, need to be in strict APA format. The next couple pages of the syllabus are similar, the same as your other courses. There's nothing different there. Just a couple things I'll touch on. Again, for theory, for your classroom attendance, we use the SAS rubric as we always have. And again, please tell me if you will be late to class, if you need to leave early, or if you will miss a class. Definitely I can work with you, but please let me know where you're at. If you don't let me know, then I start to worry about you. Also, please refer to the syllabus for late work as well. So next, I'm going to skip to page 8, and that's where the grading starts. So it talks about exams. Again, all of our exams will be on the computer, in the computer lab. And for your exams for this course, you must have a 73 average on your exams before any other assignments will be tabulated into your grade. So if by chance you do not have a 73 average on your exams, then essentially you failed the course. A 73 is a C. It's the lower end of a C, which is what we require in all of our courses to pass the courses and progress in the nursing program. So again, at the end of the course, all of your exams only, not quizzes, exams need to average at least a 73. And there, we will do rounding. So if your total exam score is, for example, a 72.5, it will be rounded up to 73. A 72.4, for example, will be rounded down to a 72. So there will be rounding there. The makeup test, exam, or quiz procedure is the same. Kaplan is the same as well. So again, we'll take a proctored Kaplan exam towards the end of the course, and there will be remediation involved with that. So going on to page 9, other assignments for this course, you have 3 exams and 2 quizzes. They're all 50-question exams, just like what you have been doing. I'm going to try and ramp up the alternate style questions, as I got word this summer that when you take NCLEX, your boards, they are changing the style of question. They're not changing the content or the blueprint, but they are definitely changing some of the styles of questions. They're piloting it right now. I don't know if it will be the real deal when you take boards, but we'll let you know as soon as we know. So I want to make sure that I'm preparing you for that. So I'll try and implement a lot more alternate style questions. Definitely multiple choice, but a lot of select all that apply, fill in the blank, like with your math questions, try and have more hotspot questions. So they're really focusing on clinical judgment for boards. They're really ramping up how their questions are assessing your ability to critically think. So I just wanted to make sure you were aware of that change as well. And I will try and make sure that my exams reflect that. You'll have a research article critique, which I'll talk about, a case study, preclinical assignment, 2 discussion boards, and then your Kaplan and SAS. So the research article critique is similar to what you did for MedSurg 3. However, this time you get to choose your article. I will need to approve your article, but it'll be your responsibility to find an article that you will critique. Again, please give me plenty of time to review it and approve it. Definitely, you can't expect me to approve your article the night before this assignment is due. So please be looking for an article now that interests you, that would be related to critical care. Definitely after our first week of class, I think you'll get a lot more ideas on maybe what type of article to look for. So again, some of the guidelines, and it's kind of similar to what you did for your research class as well. So just follow the guidelines, and it's important you use APA format for this paper. So you need to have headings, you need to cite properly. Definitely at this level, your senior level, I do expect that the grammar is the papers are well written with proper grammar. You need to use headings, make sure your citations are accurate, and that your reference pages are accurate as well. The next assignment is your case study. This is a really fun assignment. It pulls in a lot of evidence-based practice. And again, as we talk through your first week of class, you'll get a lot more ideas on evidence-based practice to pull in. So for this case study, you're actually going to take a patient that you cared for in clinical. Again, that patient must be approved to make sure that it's a good fit for this assignment. So be thinking about that early on in your clinical about a patient you want to utilize for this assignment. And you'll be using evidence-based practice. So again, that can be scholarly journal articles. It could be the CDC website. It could be policies, procedures, so things like that. You need at least 2 references within the last 5 years. You can use your textbook to explain pathophysiology of your patient's disease process. This is a new assignment, so I'm anticipating it to be about 8 to 10 pages. But as you are writing the assignment, you can give me a heads up if you're like, oh gosh, there's no way I can get 10 pages, or wow, I'm writing like 15 pages. So keep me up to date on that. So I'm just going to go through the grading criteria here real quick. So first you're going to introduce your patient. With a caveat for this assignment, do not put your patient's name at all. Do not use patient initials or any way to identify your patient. You can use the words "the patient" for this paper. You're going to explain the pathophysiology in your own words. And for there you can use your textbook, but you'll need to cite a scholarly source as well. Then you're going to talk about a plan of care. So it all goes back to the nursing process that never goes away. So you're going to discuss 2 nursing diagnoses, provide rationales and goals for this patient. And then next I want you to talk about the multidisciplinary roles. And as we get into critical care, you'll understand, and definitely more so, you see a lot more members of the healthcare team play a part in your patient's care. So I want you to describe the roles that you saw when you cared for this patient. Things you saw with your resource nurse, nutrition, respiratory therapy, the doctors, speech therapy. So again, when you're caring for your patient, make sure you take note of all those people who come in your room who care for your patient. What do they do? What are they communicating? How are they helping your patient get better? So again, like they say, it takes a village to raise a child. It takes a village to really care for these critical care patients. The next section, I want you to talk about legal or ethical concerns that there are with your patient, which definitely a lot of those seem to pop up in critical care settings. If there weren't any actual legal or ethical issues that occurred while you cared for your patient, you could think of potential ones and elaborate on what could happen or what potential things could happen. Next, you're going to pull in that evidence-based practice to your patient. Again, knowing what to search for, what articles to find, will depend on the patient you choose and what issues are going on with your patient at that time. And again, please use APA format for this paper. Very important. The next assignment is on page 12, which some of you may have started already, and it's just called a preclinical assignment, similar to what you did, I think, for PEDS and OB. Since this is a specialty area, there's a lot of new things that you haven't learned yet, so this will just kind of help you be better prepared for your first clinical day. This is a graded assignment, so the more thorough you can be, the better your grade will be. If you write, 2 words for each category, you won't get a very good grade. So it is a grade, but also this is for you to use. So it's for you to have a little cheat sheet you can use in clinical and as you're prepping. It is due before your first clinical day, which is actually simulation. So please have it done. It would be next Thursday, I believe, is when simulation is. So again, the more thorough, the better. And again, it will really help you out going into the real clinical setting that first day. There will be 2 discussion boards for this course. They haven't been posted yet. There is a rubric for that on page 14, so you will get graded on your discussion board post. At this level, you guys are seniors, so I expect your discussion post to be thoughtful, to be spelled accurately, to be grammatically correct, full sentences, and you'll need to respond to peers. And I expect your responses, again, to be thoughtful, to stimulate more discussion, not just oh yeah, that's a great thought or good job. So definitely you need to put some thought into it as well for your responses. On page 15 is the calendar, the weekly breakdown. And again, if you've noticed, we're trying something new with the courses to have lecture 2 days a week rather than 1 day a week for 4 hours. So I indicated there when your exams are and dates of when assignments are due. So we have class Wednesday, Friday, and I have a topic outline. On Blackboard, I will tell you what you need to do for each day. So Wednesday will be day 1, Friday is day 2 for each week. So I'll say day 1, these are the materials, and I'll have a ticket to class for each day as well. So please come to class prepared to learn. I'm going to have a lot of activities. I'm not going to stand up and lecture a lot. I'd like you to have more interactive time, so it's imperative that you come prepared and that you do your ticket to class assignments. So please look through pages 16 and on with the weekly objectives. Again, that's how we write our exams. We blueprint our exams to the weekly objectives. So that's always a great place to study when you start, is to look at those weekly exams, or weekly objectives, excuse me. On page 23 starts the clinical part of the syllabus. Again, pretty similar to your other clinical courses. Not a lot has changed there. The format does look a little different, so please read through that. But your expectations are very similar. You need to prepare for clinical the day ahead of time, and you need to come prepared to care for your patient. Again, in the ICU, I know it can be scary, and it's a lot of monitors and tubes and patients you haven't experienced before, but it'll be very hands-on for clinical. For the most part, you're going to be paired up because the patients are so sick. There'll be 2 students per patient. In some cases, it'll be 1 student for 1 patient, depending on how sick the patient is. But again, you need to come prepared in clinical so that you have a good knowledge base. You don't need to know everything, but you need to have a good knowledge base and at least, have attempted to understand your patient. So you got to meet us halfway there. You need to come on time. If you're not on time, you're late and you get an unsatisfactory. Again, you need to come prepared. You need to wear your name badge. You need to be dressed professionally. You need to complete Passport and Castle Branch before the simulation day. Also, we'll be doing the math competency assessment that very first day of class on Wednesday. So before we go over little bits of the syllabus, go into content, we're doing that math competency right away. I posted some review information for you on Blackboard, so it is very imperative that you go through that so that you're prepared to do your math competency on that first day. Please refer to the syllabus for the requirements. Again, you have to get all of the questions right. If you do not get all the questions right, I'll give you a new exam with different questions. If in the meantime you need help and you have questions on pharm math before class starts, please email me and I'd love to help you and sit down with you and talk through it. Again, for assessment, For this course, since you are at the senior level and the expectations are higher at the senior level, you will have either a satisfactory or an unsatisfactory for the week. There will be no needs improvement, so either you do it or you don't. But we do want you to improve each week, definitely. So faculty will give you a lot of feedback on what you're doing well and things that you could do better. The clinical paperwork is similar. You'll need to do 2 nursing diagnoses. You'll need to do your critical thinking sheet. You'll need to do your lab value sheet. And then this time around, if you'd like to, you can make your own med cards. You cannot buy pre-made med cards. You need to be writing down pencil or pen to paper to make your med cards. And then on your old medication sheet, it had that column for why is the patient on this med. You need to know that column and nursing considerations, because faculty will ask you. Again, that's making those connections, is why is the patient on the medication. So please fill out those forms. You'll need those completed when you come to clinical. So they must be completed before you come. Again, in the ICU, the instructor will need to be with you to do most all your skills and meds. As the instructor feels comfortable with you doing something independently, they'll let you know. But again, the ICU is a whole new ballgame, a whole host of new medications and tubes and lines and all that jazz. So we definitely will be with you, and it'll be very hands-on. You'll be doing a lot of hands-on in the ICU. You'll need to do your self-reflection just as you have. That's due 24 hours after your last, after clinical is done. So if you're done with clinical at 7 at night, your self-reflection will be due at 7 p.m. the next day. Again, you can email those to your instructor. So email the self-reflection to your instructor. Your instructor will give you feedback and email it back to you. For the other clinical evaluation paperwork, that'll be in a folder. So you'll just swap folders back and forth with your clinical faculty member. So again, you don't need to upload any clinical paperwork to Blackboard. You will be emailing your self-reflection to your faculty member, and then you each will have a folder. So at the end of the day, put your completed paperwork in your folder and give it to your faculty member. You will need to make up missed days. So if you miss a day or you miss a part of a day, you will need to make that up. You can use your Nursing Central in clinical, but make sure you use it in a break room or in a little nook, not in the patient care area. Right, I think that's all that I have for now. I think I'll upload another video talking more about simulation, and I'm excited to see you next week.